from all over the world will be joining us through the month of Ramadan. So please stay tuned and connected with the Makkah Islamic Center. You can find us on Facebook and Instagram, and you can always, Sufi Council of Toronto, on all social media platforms to stay connected through the month of Ramadan. Inshallah, Dr. Muffaqam Shah Sahab was born and raised in Markham, Ontario. He was a former YMCA lifeguard and swimming instructor. Mashallah. He graduated medical school of Deccan College of Medical Sciences from Hyderabad, India. Some of his accolades during the time include graduating with honors, mashallah, in the first division and receiving the gold medal for the highest marks in general surgery, mashallah. He completed clinical clerkships in both primary care radiology and neuroradiology, respectively, from Harvard Medical School and the Yale School of Medicine, mashallah. He is a registered medical practitioner certified by the Telangana State Medical Council in India. He is currently working as a preventative telemedicine consultant, as well as working towards securing a medical residency position in the field of diagnostic radiology. He's given multiple talks, interviews, etc. at this alma mater institution about the importance of effectiveness of nutritional therapy for managing obesity, diabetes, gout, and other lifestyle diseases. So without further ado, on your screen, Dr. Muffaqam Shah. Assalamu alaikum. Dr. Saab, how are you?
Walaikum salam, doing well. Thank you for having me.
Mashallah, I appreciate your time. I know it's a crazy time right now, especially with the pandemic. So thank you very much for taking the time to join us today, and as usual, join us every year to build awareness for healthy Ramadan.
Absolutely, my pleasure.
So Dr. Saab, we'll get right into it. I know we're going to have a lot of questions, just like we've always had in the masjids that we've done the last 3 years. So I guess we'll kind of do it in two parts. The first part, just a general, your perspective of what's happening with the COVID-19, the prevention, to build awareness, social distancing, etc. If we can kind of talk about that, and then we'll open up the channels for questions. So I urge the viewers to ask questions, and Dr. Saab can kind of answer on his perspective. So we'll talk about that, and then we'll cut it in half, and then go towards healthy Ramadan, inshallah.
Sure thing.
So I'll turn it over to you.
Okay. So as far as the COVID-19 situation that we've had, we've all been going through together. It is something new that we haven't experienced as a community or as a society, at least in our lifetime. And I feel that for the most part, we've been doing well. We've been, for the most part, following Health Canada's guidelines to our best of our ability. We've been keeping up to date with the new developments. We've been making sure to check in on people. We've been trying to keep our health in check. So give yourself some credit. Everyone's been doing well compared to what we've had to deal with. But as far as what we can do better, because we do still have some ways to go, right, before we can actually be on the downward trend and be done with a lot of these measures, we have to continue what we've been doing and build on those good positive changes that we've made. So as everyone knows, the most important thing is definitely the physical distancing aspect of it. So making sure that we do stay the 2-meter radius apart from people around us, making sure that you practice very, very good hand hygiene, coughing and sneezing hygiene, as well as the main aspect, which is taking care of your health. Like, this is the perfect time to take an audit of what you're bringing into your health, what you're cooking, and what you're actually putting into your bodies. And is that helping you in your health, or is that making it harder for you to possibly fight these infections? And so I think there's a great opportunity for us to actually, build on the stuff we've already started, and then hopefully take it further and actually go towards preventing anyone from getting this disease. Or even if we do get it, give ourselves the best possible chance of recovering from it and fighting it, and actually coming out on the other side stronger and healthier.
Well, mashallah. So, Dr. Saab, just from your perspective, if you can stress the importance of social distancing, as well as safety measures and precautions that we can take to kind of bend the curve, let's say.
Hmm. Yeah. So I thought about this a lot, how I wanted to tell people, and I feel like the best way is to kind of explain to them exactly what's happening around the air around them, because everyone has been hearing 2 meters apart, physical distancing, social distancing, and we've heard it time and time again, right? But if someone actually understands, what the reason for this is, then I think it would make their lives a lot easier in actually implementing those changes. So what we really need to do is that you can think about people around you. Of course, when we talk, when I'm talking right now, when we sneeze, or even when we're just around someone, we're all releasing some sort of particles from our mouth. It's very, very minuscule. It's on the microscopic size. You won't see it. You won't even feel it. So if you can imagine that every time you talk, every time you're in the vicinity of someone, they're releasing something from their nose, from their mouth, and other places. So if that is going on and it is falling onto surfaces, falling onto food, falling onto doorknobs and any other surfaces that we touch, our cell phones every single day, and then someone else touches that, because this virus does live on various surfaces for prolonged period of time, be it 4 hours to almost up to 72 hours on certain surfaces. So if you're touching those things and not washing your hands again and bring it into contact with your mucous membranes, which is our eyes, our nose, our mouth, things that are in contact with our bloodstream, then all of a sudden you've given it a route to get in, right? So if you can just think, the reason why we wear a mask and the reason why we want to keep far from everyone else is that even if someone were to kind of, disperse those droplets that have some virus in it, you're minimizing your chance that you'd ever come in contact with that, either through the direct route or even if it were to fall on something, through you actually touching and bringing it in. So you're greatly reducing the risk by practicing these measures. So if you think of it that way, it makes a lot more sense why we're not told to stay indoors and not really go outside, not meet our closest family and friends. There's a reason behind all that, right? So if someone understands that, it makes it a lot more simple and much more easier to follow the recommendations rather than someone saying, "Oh man, why do I have to do this? I don't want to be cooped up inside all the time. What's the point of social distancing? I know that person, he's healthy. There's nothing could have happened," but you don't know who's come into contact with who, or not even what surfaces they've touched, right? So for the betterment of everyone, understand the reason why we're doing it and how it's going to help you, right, to stay safe, because everyone wants to keep themselves and their family safe. So I think by putting it that way, people are much more likely to follow these guidelines.
Mashallah. Dr. Saab, the biggest thing that we get, I guess, from the news, etc., we don't hear it from the likes of doctors like yourself.
Hmm.
They are the general, runny nose, the cough, the temperature. But we're also hearing on the news that sometimes you don't know if you have the symptoms. So it gets hard to kind of defeat this disease, I guess you want to call it. So
Hmm.
what measures can we take to kind of prevent all of this from happening?
Right. So as far as prevention wise, I think it's a couple of categories, right? So we already talked about the physical distancing as well as the hand hygiene, coughing hygiene measures. And then now we can bring it more towards the actual health aspects of what you can do yourself to actually um, prevent yourself from this infection, because it doesn't discriminate old or young, based on color. It's all about the way it gets in, right? So the way this virus gets in is that it'll use some sort of tissue that we have for our nose, our eyes, our mouth, and it'll burrow in to those receptors and it'll be able to infect. And all a virus wants to do is just to replicate. That's the only thing it knows. It wants to replicate in that cell, and as once it's full, it bursts that cell and it keeps replicating. So then the symptoms that we experience are basically our immune system fighting it off. So people experience, vague symptoms such as fevers, headaches. They have muscle pain sometimes, a sore throat, a cough, a runny nose, and sometimes people have diarrhea. As you can see, as I'm listing this out, these are such varied and general symptoms that, like you said, people are not sure if they have it or not, right? So what they can do is that, of course, you still have to follow, Health Canada's guidelines as far as if you do feel like you have it, then of course give your primary physician a call, as well as even reaching out online to be able to take a small self questionnaire to see if you qualify for testing, or if this even is possibly, the novel coronavirus. So those are obviously things that you should do. But as far as people worrying, do I have it and do I not know? We will see some symptoms, right? There will be some kind of indication because, like I said, the virus is doing something, right? It's getting into those certain cells, be it in your throat, in your nose, or in the lung tissue, and it's replicating, right? And those cells are somewhat getting destroyed, and the immune system's coming in to try and help it fight it. So there will be some symptoms. You're not going to be sitting around, lounging and say, "Do I have the virus or not?" You'll have some sort of indication. It might take up to 14 days to be able to notice them, but they will come. There will be some symptoms, and so I can probably dispel the myth of that. If you've been, for the most part, following the proper measures, and you've been staying relatively healthy, staying away from most people, and you're sitting at home and you feel okay, then you most likely are going to be okay. And of course, keep monitoring yourself, right? But the anxiety and the fear of, do I have it and will I not even know? That can be dispelled. There will be some symptoms that will show up.
I guess the $1,000,000 question, Dr. Saab, is why isn't there a vaccine?
Yeah. No, so I was just reading up right before this talk. I was making sure that I could be right up to date so I give the best information to everyone. Is that at the moment, the WHO is conducting a mega trial, which is essentially instead of having like one or two drugs that they're going to follow and see if they're going to be effective, they're putting all of these different various interventions all at once to see which one would be able to help us. And they're also, it's fluid. So they're making sure to change it or add in new stuff or bring in different things. So it's all ongoing. But the way with the vaccine works is that even if they've, identified the DNA and they've made the vaccine, we can't just give it to 30 million people in the entire world unless it's safe, right? And that takes time because you have to give it to a certain small group of people who might have been affected to see if they've actually recovered. And there's a certain procedure. It's not just like political or any kind of like red tape or any kind of like bureaucracy that's involved in like why it's taking so long. There is actual, scientific reason because you have to give it to actual people. You can't give it to mice or rats and hope it'll transfer over. You gotta give it to real people, and they have to see actual results, and then you have to quantify the results. Make sure that okay, if everyone got this vaccine, the people who have it would hopefully be prevented. People who don't have it also prevented. So you have to make sure that it's the right one, right? Before you can just give millions of people a drug that might be harmful. So that's the main reason why. But as far as interventions that are being done, you've probably seen tons of fake news as far as this will help or that will help. But do know one thing, that if you were to get it and you were to go into the hospital and you were to be treated for it, there are interventions being done, right? They're not just going to leave you alone and hopefully hope for the best. There's always constant talk between medical professionals, and they're getting the latest guidelines, and so they're trying different medications and to see who's getting better, because this coronavirus, it's a has genetic similarity to the original SARS virus that happened. So that's why we call this SARS CoV-2, right? Because it's similar. So we do have some stuff that is similar, so we can try different things, and it is working somewhat, right? But it's not enough to say, you know what, this is a drug that's perfect for this, and everyone can start taking it. But know for sure that if someone were to get it, there are interventions being done, and people are on certain medications that are working, and they're trying different things. And there's the results, and all that stuff is going again into studies, into the mega trial to be able to say, you know what, we have this much data that this many people received this medication and it worked, and then hopefully down the line we'll be able to use that to recommend the proper treatment. But for now, stuff is being done, but there's no one vaccine or one medication that we can recommend that say this is preventative for the SARS-CoV-2 at the moment.
Mashallah. So I guess we just have to be patient. And here, another question one of the brothers asking is why the 14 days? What's significant about 14 days?
Sure. So 14 days is more so what we've seen in the literature and the scientific papers of the sort of the max limit of when symptoms have been shown. And it's a range, right? So it's not necessarily up to 14 days or always 14 days. It can be 4 or 5 days, 7 to 6 days, right? It depends on the person's immune system and how it reacts. So someone whose immune system who is relatively like very pro-inflammatory, a lot of stuff can be released all at once and they'll feel symptoms, right? Someone who has a not so great immune system, it takes more time for it to mount an attack on those viruses. And so it might take longer for them. Again, there's no quantifiable measure to see who's going to develop them when, but what has the 14 days that we've got is from the literature from China, from the previous cases where you've seen the range, like the wide end of the range is the 14 days. And we've also seen, some more outliers, of course, like the crazier numbers. But as far as the ones that are more so, in our standard deviation, you'd say 14 days is the one that you can say up to 14 days you'll have some symptoms. Before that, it is possible that people can be going around who are asymptomatic. They're fine. It's still the virus still replicating, the immune system is still mounting an attack against it, and they feel fine for the most part, right? So that's why we have to practice all these measures where, like, even if someone isn't coughing or someone isn't, symptomatic, you're not sure if those tiny droplets are falling on something or if they're coming around and you're bringing it into you. And so that's the reason why we mentioned the 14 days to tell people, even if someone is asymptomatic, they could possibly still harbor the virus. So it's more a precautionary a number.
Mashallah. I guess I'm going to put you on the spot here a little bit. To the best of your knowledge, are we bending the curve? Are we getting better, or do you think, in your professional experience and your professional opinion, how far, if you had to make an educational guess? I guess you're not putting a stamp on this, but I guess that's the top. When is things going to get back to normal?
Yeah. Yes,
so kind of your perspective.
That's probably the $1 million question, right? Is when can we all get back to normal? So I think definitely what we can look at is the daily counts that we're getting from our health authorities of the new number of cases that we have, the number of recovered that we have. So based on that, we can see, and we're plotting it every single day, and we've seen an uptick, and now we've, for the most part, have seen a steadiness, right, in the number of new cases. We're not saying that we haven't seen new cases. We're saying that the number of cases that we're seeing are for the most part staying steady. And so if you make a graph, you can see that graph has kind of started plateauing. And hopefully after the plateau, we do see a fall. And so that's what we're all hoping for. And so we can look at other countries that have had similar situations, the numbers that we've had, and similar infrastructure changes that we've had, health measures that we've had. And we can look at them to make an estimated guess to see, okay, we're probably like 2 weeks or 1 month behind this country or this region. And so we could, for the most part, it's still day by day because you don't know how many people are getting tested. It's not like it's a numbers game, but it's still humans are still involved. And so what we have to do is monitor every single day and see when do those cases, the new cases, start dropping slowly, and we're plotting. And then we know, okay, we're past the plateau, we're probably on the downtick, but we have to make sure that we do our part and keep doing these measures, because that's what's going to keep that thing going, the line going down. If we were to say, okay, fine, there's only 300 new cases today, awesome, we're on the downtick, and we all go out and stop, practicing physical distancing, then we're going to see that rise again, right? Because the reason we have all this drop is because we're all being so diligent and doing our part, and we have to continue that. But we can definitely look at other countries and make an educated guess and hope that we follow the same trajectory. But it depends, right? It depends on how many people are going out and how many people are interacting. So it really does depend on us, right? So we've seen in models that people have made with algorithms that if you have like a very, very tight amount of social distancing or physical distancing, then it can take this much time. So it depends on us. If we are very, very strict with our measures and our our adherence to this, then we can hopefully be back relatively soon. Is what I'm gonna say. I'm not gonna put a time on it, but relatively soon. It's if we're able to contain ourselves.
No, mashallah. It's very, we get the question asked all the time is when is things going to get back to normal? So we just got to continue doing our due diligence, and inshallah it will get better. Dr. Saab, if you were to, because everyone I guess is, another question just arrived, so I'll go to that, and then inshallah we can go into, I guess, where everybody is waiting for is the healthy Ramadan part. So the question a brother is asking is, once a patient is affected by COVID-19 and they are cured, is there possibilities that it may come back or relapse?
Yeah, it's actually a very good question. I was just reading up on this, and we've seen data from other pandemics we've had, the SARS or the MERS viruses, wherein um, patients who have had the viruses, they've got the disease, and of course, their immune system has been able to fight it for the most part, and then the symptoms that they have are dissipated and they feel better and they're discharged for the most part, right? But you have to, again, I think it'd be a lot better if I told people the way these things work is that that virus, when it enters those cells, it's replicating in the millions, right? So all these different cells, and it's containing, and the immune system, of course, is containing it. The symptoms we really feel are because of our immune system trying to attack it, trying to clear this thing out, right? So once it's kind of kept it at bay at a certain point where it's not really causing too much harm to the immune system, and the immune system doesn't have to mount a huge attack on it, that's when those symptoms start going away, right? So again, if you were to swab someone who's already been cleared of coronavirus and you swab them again, which I don't know why you do because you don't have that many tests, but if you were to, which people have done in other countries, you might still find it positive, right? Because it might still be in those cells. However, it might not be at such a huge level that is causing the immune system to mount an attack on it. You might have antibodies in our system that are able to fight that. So as far as like being the actual swab positive, yeah, it is possible and it is happening. But as far as the actual like disease that you feel from it, the symptoms that you feel, once you've kind of passed that phase, we've seen from most of the data that the antibodies are forming and it's being kept at bay. And we need more data. We have to see a year down the line, are we still going to see virus particles inside of those cells? Is it going to be something that's going to happen seasonally every single year? Will it be something that you have lifelong immunity to, like some viruses, right? Because all of them act a little bit differently. So because it is a novel coronavirus, we're still learning every single day about certain things. But again, the general principles or the laws of immunology and the way our immune system works, that still applies, right? For all the viruses. That's what we can apply for here and gives people that, once you've got the symptoms have cleared, you should be okay. We'll keep, we can still monitor them if people have issues later on down the line. But as far as someone going out there, getting coronavirus, and then going through the symptoms, and then all of a sudden getting it all over again. We need more data to see that, but we have seen some results where people do have antibodies. So, but only time will tell when people who have been infected are possibly reinfected, and then we'll have to see if those antibodies are helping or are they not as effective. But at this moment in time, their studies are ongoing that are answering that exact question that this viewer has, and only time will tell.
I guess it's a very good answer because it's still new to all of us, right? So I can only imagine how new it is to obviously the medical field. So, Dr. Saab, if you were to wrap up, kind of in a general overview, your kind of message to the public about COVID-19, if you can do that for them, and then we'll inshallah go into healthy Ramadan.
For sure. So the general message I wanted to get out there to everyone with this platform would be that, again, we've done a tremendous job so far in actually being able to change the way our society works and the way we do things day to day for the betterment of everyone else, right? We've already taken, such a selfless act as an entire country. So we have to continue doing that because it is working. We've seen that the cases have steadily started to plateau off. And if we wanted to eventually drop off, we need to continue these measures and maybe even be a little more stringent with them, right? We shouldn't jump right away into, it's a month and a half, it's too much for me to handle, time to get back to regular life. Regular life will get back as soon as we're able to actually, bring these cases down to a point where our healthcare system isn't so extra burdened. And so it's on us. So that's one thing I wanted to say is that keep doing what we're doing. We're doing the right things. Take it day by day. You don't think so much, I'm only going to get back to my regular life once all this stuff is done. This is a great opportunity for us to, expand our knowledge, expand our other interests, and actually, take this time to be with your family. It's a great blessing in itself, right? For some people. So take it day by day. Don't live your life waiting for 2 months or 3 months down the line. Live it right now. Whatever in whatever way we can. live it and be happy, and and hope for the best, and take your measures, take your protection. And after that, leave the rest to Allah subhanahu wa ta'ala. Believe in the qadr of Allah. Don't be so paranoid. Don't have so much anxiety. Anxiety, mental health is a big issue right now for every single household. So yeah, so definitely, take it day by day. Secondly, I wanted to say is, of course, this is segueing into the healthy Ramadan part, is that this is a great time to take care of your health and to get your body in check and to be able to be in the best position to be able to possibly fight this virus. It's a great opportunity for us because we're all, for the most part, cooking our own home meals and not eating out as much. So a lot of the other stuff that the excuses that we had before for a relatively bad diet are kind of gone now. So it's a great way to start learning how to cook, start learning about nutrition and how it affects your body, how it affects your health. Start trying to, if you have those chronic diseases that you've had for many years, start trying to taking the steps to try to hopefully reverse those diseases. And again, this is the great segue into the next segment that we have of healthy Ramadan.
Mashallah. Dr. Saab, I think, you know what, I've benefited. I might not have stick to the diet, but I've over the years, listening to you, it's kind of encouraging the way that you give this next, I guess, lecture, you should call it, or teaching session, because you have done so much of this in regards to obesity, diabetes, gout, etc. I think that the highlight of what you're going to talk about is the sunnah foods. So I guess we're gonna exactly what you said, the segue into healthy Ramadan. The questions are gonna come already. We had viewers already message us in regards to healthy Ramadan. So I will turn it over to you to kind of talk about your thing, and we will jump in as we have been, like the COVID-19, and discuss how we can kind of become more healthier during the month of Ramadan, inshallah.
Absolutely. So this Ramadan is unique in the fact that, again, we're all able to finally put away a lot of the distractions and the other things that would cause us to maybe not fulfill Ramadan in our best capability, right? Both in a spiritual sense and in a dietary sense. Wherein the dietary sense, wherein we'd have, parties or get-togethers, or we'd have, dinners, or huge gatherings where, what, if the host is going to feel bad if I don't, indulge in the food they serve me. That's all gone. Those excuses are all gone now. And then again, with the spiritual sense, it's an amazing opportunity for us to really focus on our own ibadat, on our own connection with Allah subhanahu wa ta'ala, right? Wherein, again, of course, the sense of community in the masjid was amazing and everyone yearns for that. But this time we have the opportunity to just connect one on one and just better ourselves, right? Spiritually, as well as emotionally, as well as physically. So it's a great opportunity. Don't think of it as like, what, oh man, no tarawih, there's no, iftar dawats. What's the point of Ramadan? Absolutely not. It's a blessing in itself that, it's a reset button for us to be able to take all the benefits that Ramadan offers in terms of fasting, in terms of spirituality, in terms of extra prayer, in terms of forgiveness of our sins, and take all of that and then, just be encapsulated in that during this time and ask for forgiveness and, of course, and hopefully ask for protection from any of these diseases. And then, of course, take this time to be at home and to use the foods that we eat to hopefully help us prevent a lot of the diseases that could possibly be coming or that we already have, right? So it's a great opportunity. Do not think of it as, oh man, it's a wash off. I'll wait for the next one. This one's not going to be the best one, but it can be the best one, and hopefully will be the best one for a lot of people.
Dr. Saab, it's very refreshing to hear, from the medical side, how you're incorporating Allah subhanahu wa ta'ala and the importance of ibadat and that one-on-one ibadat, because we've been talking about it for so long, but then, when someone from the medical field is saying that, I think it's reassuring, and it should be for the viewers. So, mashallah, it's very, very good. I guess the questions are coming, so you've probably encountered all of these questions before, but inshallah, I know it's not going to be a hard task for you, alhamdulillah, with your knowledge. Is there, what do you think is the best way to, or meal prep, or etc., or what should we be eating during Sahri? One of the brothers asking to keep that energy level throughout the 12, 13, 14 hours of fast.
Right, absolutely. So I think we should always kind of make sure that we base our choices around the sunnah foods, right? So people who have attended the lecture in other previous years, they know a lot of these foods. But again, everyone knows that dates are a superfood for suhoor and for iftar. So as far as what someone, just for his specific question, just for cereal, I'll answer that. And of course, I'm sure we'll have more questions down the line for the other stuff. So I'll answer just that for now. For sehri, I think it's really important that you do make sure that you are well hydrated. And so drink enough where you feel like you're not thirsty, right? Don't overdrink, hoping that, you'll be able to somehow store it like a camel. Drink enough that you feel like you're not thirsty and you feel, well hydrated. The way you feel you're hydrated is basically like you feel moistness on your tongue, your nose is not dry, your eyes are not dry, your skin feels okay. That's how you know you're well hydrated, right? And of course, you have good bowel movements. Those are all the signs that you can kind of look towards to see how much water is enough for one person. And then the second thing, of course, would be for longer energy that someone wants is fiber, fiber, fiber. And so a lot of people stress on protein as if it's this magic thing that everyone's always building muscle all the time. It's not the case. Protein is necessary, of course, to rebuild a lot of our tissues, but we get a lot of it in our food already. Very few people are actually protein deficient. Mostly, a lot of people are fiber deficient. And so fiber is in lots of things. It's in fruits, it's in vegetables, it's in whole grains, it's in legumes, it's in, again, beans. It's in so many foods that we already have in our diets. We have our whole grain rice, we have our dals, we have our, like legumes, be our beans, and then we have our fruits and our vegetables. But those are sometimes pushed to the side. And people have kind of more so gone towards, the meat heavy foods because of the protein, or the fat heavy foods because I think that'll take them a long time. But again, switch more towards the whole food plant based meals, which is fairly simple, right? Granola with cereal, or if you have some brown rice or whole grain rice from the night before with whatever vegetable curry that you have. A good bowl of fruits, with berries, with whatever seasonal ones are available to you, some vegetables, be it cucumbers, carrots, all of these things. If someone were to eat this in sahur, absolutely they'd have no issue with energy at all. They'd absolutely be able to last the entire day, because imagine all the nutrients you're giving your body, the fiber you're giving it. It's able to hold on to that water, and then of course the healthy carbohydrates that are in there, because they're all so slow absorbing. You don't have that huge spike in insulin. You're able to actually have a longer duration of energy. So definitely oats are a power food in sahur that I use personally. Oats with some dates, and then you got some fruit, and then make sure you get your greens in with a little bit of light salad, or even some sliced up veggies on the side. Good amount of water, and again, you see right here, I'm focusing mostly on these whole foods. There's very few like meats or oils that are in here, because we don't really need them in the morning that much, right? We want long-term energy. We don't want these spikes. We don't want to feel drowsy for the rest of the day. And so stick with the whole food, the sunnah foods, of course. You have honey, you have your dates, you have your pomegranate. Uh, I would always recommend plant-based milks. So all those things that if you incorporate them, absolutely, you're gonna have no issue, inshallah, sustaining your energy throughout the entire day.
Mashallah. Um, this next question, Dr. Saba, is a brother who suffers from thyroid issues. What foods are good for
Mhm.
thyroid patients in Ramadan? The male side, it's a brother that's asking.
Okay. So for thyroid, you have two different camps. You have either someone whose thyroid is very active, which is a gland right here. If it's very active, and then they feel hot all the time, they burn calories excessively, and they're always hot, they're always sweating, and then their thyroid is very, very active. So and the opposite you have is someone who has an underactive thyroid gland, which is quite common in our community or in the entire population. And that is where basically someone is generally lethargic, they put on weight easily, or they don't lose weight easily, they get pretty cold, their skin might have some changes, they might have a swelling over here. So that's the majority of people that I've seen, at least, are have an underactive thyroid. And so again, I think the best service I can do for someone would be to actually explain to them what is happening in their body, because that gives them power. I mean, what's happening here and what is causing my symptoms, and how can I then use that knowledge to be able to hopefully, keep this at bay, or even reverse this, or even make sure that I'm doing the right things for this. So with underactive thyroid, you essentially do have something that's going on that is causing that those antibodies, or some inflammation in your thyroid that is not able to pump out the right amount of the hormone that is necessary for every single one of our cells. And so if you think about it that way, something is going on, some kind of insult is happening here, be it antibodies, be it inflammation, be it genetic, something's happening, right? And so all you have to really do is, if you got the root cause of it, which would take some time with your medical practitioner and figuring out, of course, your medication. So one tangent is, make sure that your medication continue, right? So if you're hyperthyroid, make sure you have your medication. If you're hypothyroid, continue your medication. I'm talking about the foods that you can do to help you along the way. So anti-inflammatory foods absolutely are going to benefit both camps. The anti-inflammatory foods are the ones I just talked about in the last question again, were the sunnah foods as well as the whole foods that are plant-based. And rather than talk, and then of course we have our berries. We have our basically all fruits, but the berries are a power food in terms of anti-inflammatory. And then of course we have our I'll talk about the things that are pro-inflammatory, so you can stay away from them. Maybe that makes it a little easier, right? So what do you stay away from? Again, it's pretty simple. The processed oils, the hydrogenated oils, the snack foods, the heavily smoked or overcooked meats that we have, and then of course the dairy. We know now, it is very inflammatory. 65% of the world population is intolerant or sensitive to dairy. So cutting that out is a big thing. I think a lot of people who have these chronic diseases, if they were to just try that one thing, if you just listen to one thing I said today, and you just cut out the dairy from your life with all the processed ones, and put it in the plant-based ones, be it the oat milk, the soy milk, the cheeses. If you like the cheeses, use the plant-based versions of those. If you were to just that, you'd be taking a lot of inflammation out of your body. And then you'd replace that with your fruits and your whole grains and your vegetables and your legumes and all these whole foods that are again sunnat, and that are again have shifa in them, inshallah. So if you do just those simple tweaks, and if you understand what's going on in your body, no one is deficient in a little tablet that they get, right? You haven't had that your entire life. That's just there to help you and keep those symptoms at bay. You gotta look at the root cause of what's actually happening and why are we having these symptoms, and how you can take that into your own control, right? Don't think that you're gonna be cured in 5 years by taking a tablet every single day. No, you gotta go to the root cause and see what's causing these things, and what you can do personally to be able to, help yourself.
So Dr. Saab is telling you all the good stuff don't eat. No, so no, all jokes aside, it's very important. But that same brother just messaged again and asked in regards to his medication, because you were mentioning medication, when should they take their medication if they are fasting? So should they take it at the time of sahur, because obviously there's a gap, they're saying of 30 minutes that they need, or is it at iftar time?
Is this brother the thyroid patient or the diabetic patient?
No, thyroid.
Thyroid patient. Okay. So for thyroid patients, usually the way that, I'm assuming he's hypothyroid most likely. So the way the medication usually works, it's just a replacement for the normal hormone your body already creates, right? So your body is low on that hormone, so you take it once a day, and it's able to kind of keep you at base, so all your cellular functions are able to perform normally. So if this brother wanted to take it whenever he is the most active, right? So if he's going to be, for the most part at home the entire day, which most of us are, and kind of like, doing most of his activities during that time, then the best time would be before suhoor, right? But if he's someone who is possibly working a night shift even during this time, if he's an essential worker and he's going to be doing most of his activities, during the nighttime, then I would say definitely after iftar, so that the hormone is there in his system to be able to help out all the cellular functions that he needs to do.
Okay, mashallah. We got a brother because you mentioned stay away from milk. And this brother says, I love ruafza. So how much calorie is it really in a glass of ruafza, and is it healthy?
No, so I would actually I was prepared for this question because I know everyone loves the rubza. So the easiest thing you can do is I'm not telling anyone to stop eating your favorite foods, right? Um, Absolutely, we can still enjoy a lot of these dishes. But what I'm telling someone to do is that in today's day and age, when we have so much knowledge, so much new information that our parents and our ancestors did not have all this information, right? And again, the food system back then was different, and the foods were different as well. So if we know all these things now, it's kind of it's irresponsible for us to not kind of take some action. So we can still have the foods we enjoy. It's just do a quick Google search, or even just shoot me a message, and we can work together to hopefully find you some good meal plans. But do a quick Google search on how you can make this plant based. So if you love ruwabza, this as you walk down Walmart or Snowfield, whatever grocery store you go to, you'll see a huge section now insurgents in these plant-based milks, and they look the same, they taste the same, they're fortified with the same nutrients. They have actually a lower calorie density than even the actual dairy milks, and they're anti-inflammatory. There's no inflammation with them. So what's not to like about them if they taste the exact same thing? You don't have to have the milk just because you've had it forever. There's a better alternative, a safer alternative. Why not go with that? So I would say pick up a plant-based milk. You won't notice the difference at all. If anything, you'll like it even better. And then for the rubza, actually, yes. Get the actual ruafza syrup that you have. Measure out the actual serving size, be it a tablespoon. Put that in, and then enjoy that. It's a small little treat, and once a day it should be okay if it's in moderation, right? But don't think that you have to have an all or nothing mentality. Still have some of your favorite things. Just make them more responsible and more in a smarter way, so that you can actually help your journey towards fitness and towards healthiness, rather than inhibiting it every single time that you have iftar. You're loading yourself with sugars and added oils. Think of a smarter way. So I think I'm not sure if another question regarding oils, but I'll mention it right now. If you want to again have fried things, there's a we know we have now multiple different options. Rather than frying, you can still bake an item, you can still air fry an item. You'll get the exact same crunch, the exact same taste, but what's the point of having that 400 or whatever milliliters of oil that's going right into your arteries, right? For lack of better terms, yes, there's a longer way it goes through to your intestine, to your liver, and has different functions, but for the most part, if you think about it, if someone's eating oil, it's being stored somewhere, right? Either in your adipose tissue, in your fat, or in your arteries. So why not avoid that? Still have your delicious samosas, whatever it is, the fried foods, bake them, or air fry them, and you still get to enjoy them without having any of the deleterious health effects.
Mashallah. There's there's all these other questions in regards to food specific, but a brother just asked. He's diabetic. He
Hmm.
has to take medication 3 times a day, but he wants to fast. So, from a
Hmm.
medical perspective, what would you recommend on food that will kind of last him throughout the entire fast?
Right. So I remember actually in our last two talks, the last couple of years, we had this is a major topic, right? And I had a huge, like 4 or 5 slides on this regarding diabetes and fasting, and then I had the Islamic aspect as well. I even had the some of the hadiths and some of the ulama and stuff they actually said about this. And so I would say my recommendation would be, if someone is a actual diabetic and they are prone to different dips in their blood sugar levels, that can be a lot more dangerous, and a lot harder to manage unless someone is very, very, good at managing their medication timing and their food timing, and their hydration. It can easily go ARI, right? And we've seen it go ARI as well. So I would say look into it real quick. Ask some of your ulama, ask some of the scholars, because there are methods that you can do. Some expediation methods. Giving a hadiah to be able to make up for your fast if you're unable to. So I would say that's something that definitely needs to be discussed with your primary care physician. If, of course, you can't go in to see them right now, I would definitely say give them a call, and because they know exactly what medication you're on, what your timings are, what your previous HbA1c levels have been. Have you been controlling it well, or are you not controlling it well? What are your other comorbidities? What other diseases do you have along with this? And so that all comes into effect, because diabetes is a multi-system disease and it needs to be managed as such. So the Islamic side is pretty clear cut there. That for the most part, if you are unable to manage it, you can definitely forego fasting, and you're allowed to. give a nominal amount of money to make up for that. But if you do still want to do it, I would say definitely reach out to your PCP and make sure that you guys are on the same page with a proper plan in place. And then again, a plan in place that if something does happen, what do you have to do to make up for that, that low blood sugar, that high blood sugar, so that you're fully prepared and you're not just, okay, what, I can do it, I can manage this myself, and then going into it, and then, having these issues pop up during this time, especially when already, the healthcare system is so taxed. You don't want to have to again go into hospitals and have to deal with all that. So I would say definitely have a plan in place. You have some days. We have a couple of days. Till Thursday or Friday. So definitely get on the phone with your PCP and make a plan if you want to do it. If not, then there is an excuse for you, inshallah.
Inshallah. The same brother was asking, is it okay to have dates for iftar if you are diabetic?
Yeah. So again, if someone was here in my last couple of talks, we had a huge amount of information about fruits and diabetes, and I went into a lot of the studies that we've seen. We have new information now, new science that fruits are not bad, right? Fruits inherently, the sugar in them that we see, the sugar is not the same sugar you get from a teaspoon of table sugar or like a juice sugar. It's processed differently in our gut. It's processed differently by our bodies, by our livers. There's so much beneficial um, stuff wrapped around that sugar that your body uses to be able to actually help you. And if you don't think of food as protein, carbohydrates, sugars. That's more of the scientific method. Think of it as a information to your body. It's genetic information. Every time you eat some kind of food, you're changing something in your gut microbiome, in your genes, that you're allowing your body to either heal or to either be inflamed. So again, the date is a sunnah food, absolutely. So there's no harm in it. I would say again, everything is in moderation, right? So you can't have 40 dates or 15 dates and be like, it's a sunnah food, I'm good to go. Have it in moderation, right? But again, as long as you're not you're staking mostly towards the whole foods and having some dates and having not all the processed oils and other processed sugars, then those of course are going to have an effect on you, and the dates are only going to compound on that. But again, if you've kind of switched yourself now mostly towards a healthful diet and you're having some dates, even if you are diabetic, then absolutely, that in the long run, it will help you because it's not inflammatory and it will allow your blood sugar to relatively be stable because it's usually eaten with other whole grains, right? It's not, you don't just pick up 4 or 5 dates and eat them yourself. You have them with whatever your small amount of oats or your small amount of your rice or your chapati later on while it's still in your stomach. So it all acts together, right? So you have to kind of move away from thinking of food as just like sugar, protein, carbs, thinking of like this food as a whole, how is it going to affect me, right? And for the most part, we know how things affect us. We're smart in ourselves, right? So we know our fruit is good for us. We know data is good for us. We know that samosa isn't that great, but one is okay. So trust what you know for the most part, and don't fall so prey to oh man, this has this much sugar in it and I can't have it, become diabetic, bananas and all this stuff. I'll reference that study I was talking about, that we actually took a group of diabetics and we actually divided them, not me, the study divided them into people who got massive amounts of fruits per day and people who ate the regular diet that they already ate. And we saw that at the end of the study, the end of 12 weeks, that the people who ate the most fruit, like huge amounts of fruit, there was not only a decrease in their HbA1c levels and in their which is their sugar control levels, we actually saw an improvement in it. So, and the people who did the same what they already do stayed the same, right? And so it is beneficial. We have science backing it up. If you want to fact check me on it, you can look up the Physicians Committee for Responsible Medicine, PCRM, or you can look up nutritionfacts.org. These are both organizations that have all the research listed for you there. So again, we have new science now, we know new things, and we have to update the way we've done things. So don't be afraid of the whole foods and natural food that you've been eating for so many years. Don't be afraid of them. Absolutely incorporate them in your diet, even if you are diabetic.
Dr. Saab, can you reiterate that only one samosa?
Yeah, I would say even if it's two samosas, it's fine. Yeah.
That's gonna be
No,
a
but
tough one, Dr. Saab. Like, I'm not gonna
yeah,
lie.
even if it's if you want the samosas, have them in moderation. Just bake them or have them be air fried. there's absolutely there's no reason for us to sacrifice on the things we like, right? Because still want to live. So absolutely, still have things you like. Just be smarter because we're a technologically advanced society now. So why not transfer that into our foods and the way we prepare our foods? Why still stay stuck in the in the old ages, right? Where we just cook over a fire and dip it into oil. We have so many ways we can do things now.
No, mashallah. It's just something new for people. So I mean, it
Yeah,
gets to that.
it takes
um,
time.
yes, absolutely. Dr. Saab, this brother suffers from a lot of headaches,
Hmm.
and they don't know what the cause is. But every time it rains or snows, they they get constant headaches and migraines. How can we
Hmm.
prevent that during the month of Ramadan? They also feel it during the month of Ramadan throughout maybe, I guess,
Hmm.
the last 2 hours, their head starts pounding. From a healthy perspective, what
Interesting.
would you suggest their suhoor and iftar be?
So I would say, hopefully they're already being treated or managed for that condition because, again, headache is such a broad term. It could be caused by so many different things. If he already has a migraine diagnosis, then I'm sure he's on some medication, or on some certain protocols. But if he's not, I would definitely say to him, again, get on the phone with your PCP because they are still able to help you, right? They're not only dealing with just COVID right now. They're able to help you and help you manage these things, of course, through the telemedicine route, which can be very helpful. They're able to, get a lot of history from you and talk to you because they already know what you're on. They have your whole chart there on their laptop screen, what you're taking. So they can definitely help you. So I say the first thing, get on your phone with your PCP, make sure you have a plan in place to manage that. And as far as just the food aspect of it, I would say that headaches, for the most part, we know that they're caused by, again, somewhat inflammation, and we think of sometimes of like overactivation of nerves or a increase in blood flow. So many different theories that we have for headaches. So again, I would say that hydration is key. So as long as you are well hydrated, the cells are going to be able to function, whatever issue they have with them. As long as they can function well, it'll keep some of those things at bay. A lot of people are dehydrated in Ramadan because again, fiber is deficient, not protein. Fiber is deficient, and again, water is not absorbed as much. So get the fiber in, get the water, and stay well hydrated. That's the first thing you can do. After that, making sure that anxiety and stress is also kept at bay. And then if you have any other issues, any other things you're dealing with, make sure those are also being managed. But as far as foods, I would say that we know that berries are very helpful in actually uh, mitigating some of the symptoms for migraine and for headache specifically. And we also know that to avoid processed foods because they have been shown to actually make the symptoms worse. Like even if you were to, like for example, if someone were to have a huge piece of cake, they notice that they actually have a headache later on a little bit, in at least in somewhat, right? So minimizing the stuff that is going to just push you more towards the symptomatic side, and in taking more of the things that are going to help you more towards either keeping it at bay or maybe even preventing it. So I'll say that as I could say from the food aspect, but definitely make sure that you're on a regimen to actually keep that under control.
MashaAllah. One of the brothers, well, we'll get that. This question we'll get to towards the end. Inshallah, it was more
Okay.
personal towards you. But if we were
Okay.
going to say, so another question arises. If you were, I know you mentioned suhoor and what you would eat in suhoor. How about
Mhm.
iftar? What would you suggest a good meal, healthy, balanced for iftar?
Right. So think of iftar as every single one of your cells are completely ready to absorb whatever you give them, right? During fasting, we have so many different enzymatic and molecular processes that are ongoing that our body's using to keep ourselves, alive, basically. And once you break your fast, it's ready to absorb anything. So I would say for iftar, a general guideline would be very first thing, water and dates. And then after that, if that's even enough for you, just to kind of like you let your body kind of digest that initially to be okay, and then maybe pray namaz, and then come back towards the rest of your iftar. I would say after that again would be a good amount of fruits right away, and then get some veggies. So that's like your right away, no matter what. Like before you even eat anything else that's on the table, which is still okay. Get those in because your body is going to start right from your tongue. It'll start releasing certain enzymes and certain molecules that are already starting to digest those things, and so it's ready. So if you give it those great nutritious things right away, you'll be on the right path. And so you kind of bracket it. with healthy foods. And so then after that, it's good to for iftar to keep it relatively light. Again, you don't need tons of protein because you're not deficient in protein. You didn't just have a bodybuilding session where you went and you destroy all that protein. You don't need that much. Keep it more so on the whole grains, the stuff that's going to have you again a longer energy source. So your whole wheats, in any form, whole wheat in any form, your whole grain rices, your brown rices, your oats, and then you have any of your nuts, your legumes, your beans. Again, these can all be made into different curries, or they can be made into different salads. They can be made eaten by themselves. So I would say a good balance will going to be some kind of whole grain, be it like chapati or a small amount of oats or some rice or some brown rice, and then maybe a curry. In that curry should hopefully have some kind of some legumes like a dal or like a bean. And then again, you want to have some veggies in there and some protein. Hopefully, if you are a meat eater, you can have a small amount of protein. I wouldn't really recommend it, but if and then of course some veggies, and then of course you have your water and your fruits and your dates, and that's an amazing iftar right there. The general guideline right there. If you kind of follow that, you'll absolutely be set, and you should hopefully be good enough till dinner until maybe your late suhoor. And again, I would say even then, follow the exact same guideline. There's nothing wrong with it. You're helping your body along to keep it nourished. So whatever kind of whole grains you like, be it naan, chapati, be it your pita breads, whatever kind of stuff you like, as long as it's kind of whole grain, stick with those. And then your protein sources, you have lots of protein sources, but keep them within just a fist size. Don't have too much. Whatever protein you have for that one meal, it should be fit within your fist. And then your veggies, you can never have enough. Fill up on them, whatever you like, be it in your salads, be it in your cut up vegetables, be it in a curry. Just get those veggies in. And then your fruits, make sure you have a bowl of fruits, even if you're diabetic, non-diabetic, whatever disease you have, it will not harm you as long as you are not, going crazy with other processed foods. The fruits in themselves, don't be afraid of that banana or that other stuff because you're diabetic. It's not the issue. That's not the cause of your diabetes. So definitely stick with those, and then you can play around however you want. You can add many different curries in there, many different types of meals in there. Yeah, as long as you stick to those general guidelines, you're gonna be okay in every single meal that you have. But don't and if you want, again, those treat foods, our samosas, our pakoras, our other things, absolutely have them. It's a time to enjoy and time to share with your family. So just prepare them in the method that I recommended, which is either baking or air frying them, and you should be good.
So, Dr. Saab, you make a very good point about the fist amount.
Hmm.
So, in terms of plates, because I know in previous sessions that I've had with you, you've mentioned
Hmm.
because you'll have certain amount of foods, and then you just second plate, third plate, fourth plate. So,
Yeah,
if you can reiterate
yeah.
that, please, for the viewers.
Hmm. So I have a rule basically. If someone were to go to a buffet or to a dawat or to a party, that I had the one plate rule. That you're there to enjoy and go for it, but only one plate. You're allowed one plate of whatever stuff you like, and then after that you're done because you've already had for sure enough calories in that one plate. And that was kind of the rule that I had, or the allowance that I had for people, once they're at a gathering. But now once you're at home, there's no reason to absolutely engorge yourself like that. I would say now you can spread that out. The foods you like, the food that you guys prepared, you've been looking forward to those foods. Spread them out. Have some at iftar. Have some as in the middle of the snack. Have some again, with dinner with suhoor, and then because in the middle you're still active, you're still moving, you're still praying your salat hopefully, and then you're hopefully playing your tarawih. So all that adds in because you're not just engorging it all at once. You're spreading it out, and it's been prepared in a relatively healthy manner.
So, mashallah. Dr. Saab, a brother is asking that when he eats, it all goes to his stomach. How can we prevent that
Hmm.
with exercise, and what type of exercise would you recommend for Ramadan?
Hmm. So it sounds like it's a very very common concern because it sounds like he's feeling bloated essentially, right? Our stomach innately has it's like a flat sack of a muscle, and when you fill it up with water or food, it's a muscle. It starts expanding. So usually the 1 liter is the time when it's able to actually send a signal and say I'm full, and it takes about 20 minutes for that signal to get from our stomach up into our brain, the hormone. And so again, if you eat relatively slowly, which will hopefully allow that signal to come and allow you to feel less bloated, because eating within 5, 10, 20, 15 minutes, you're going to feel so bloated because that stomach has gone past what it usually does. The stomach, again, is a muscular fact. It can expand up to 4 liters. Those huge jugs that we see, that we get from Costco or Walmart, the stomach can get that big if you want it to. So you got to be careful. So eat relatively slowly, chew your food a lot, eat slowly, and then again incorporate those general guidelines that you have there. Even if you aren't following them, if you eat relatively slowly, the issue of bloating will definitely be minimized, because a lot of the bloating we get is from the inhaling of the carbon dioxide and the gases that we have around us. When we're eating so fast, we also inhale a lot of air, and so that causes even more distension. And again, this I want to bring it back to the sunnah, because the Prophet everyone, a lot of people know the sunnah about the 1/3, right? Fill your stomach with 1/3 food, 1/3 water, 1/3 air. But people know that that's only if you want to eat, right? If the son of Adam only requires a small amount of food, we don't have to always eat the 1/3. We require just a small amount of food. The Prophet but a lot of times he would just have water and dates for iftar. And that is the best of all creation, the best of all mankind, and that's enough for him. So why shouldn't it be enough for us, right? We're blessed that we're able to eat such amazing foods, and we're able to have these issues of what kind of food can I not eat. But really, we don't really need as much as we think we do. Use this time again to tap into your spirituality. And you know what? I want to be able to hopefully move away from all these issues. So hopefully move back towards the sunnah. And so I would say for that brother who kind of wants to avoid the bloating, I would say chew a lot, eat slowly, keep drinking water in between, and then give yourself about 20 minutes. So once the 20-minute mark hits, you feel like you're relatively full, then you probably are. If you feel still really hungry after that 20 minutes, then yeah, your stomach hasn't expanded that much, and you can still probably eat a little more, and you should be okay after that. That's what I would say to him.
Mashallah, Dr. Saab. I love how, for the viewers, how they're incorporating the religious side. Mashallah, Allah preserve you and, gave you more knowledge and towards how you can incorporate Islam with your practice, mashallah. Another brother was asking, he's urging, because he wants to get in touch with you. If you can share, I don't know if you want to share with everybody, but I mean, it's up to you, how they can contact yourself for just general advice.
The best would be email, right? And then once we have we're contacted through email, we have any of the platforms that he wants to use. We can make contact through there. But yeah, email. If you want, I can send it, and then we can have it up on the screen if you want.
Yeah.
And then they can contact me through there, or even if they want to look me up on my Instagram page. Again, everything. Even if they just Google my name, you don't even have to. You just Google my name, Dr. Muffaqam Shah, and you'll find all the ways to contact me: email, Facebook, Instagram, Twitter. Anywhere you want to reach out, I'll be able to reach out to you. So probably the easiest way would just be Google my name, because I don't think many people are named the same as me.
No, mashallah. So for the brother who was asking, Google the name, Dr. Saab's name is there, Dr. Muffaqam Shah, and then you can contact him via the social media platform, inshallah. We have 2 more questions, Dr. Saab. I know we've taken a lot of your time.
No, absolutely.
But we're going to have to backtrack because his brother has now sent it about 4 times about COVID-19. So if we can touch on that, and then I'll give you one last question in regards to healthy Ramadan. Another brother was asking. So we'll go to COVID-19 because he's urging for this question. How about if someone who's been cured of COVID-19, can they still transmit it to someone else?
Great question. So again, we have to go to the literature, the data that we have from the scientific articles, right? So we know that once this virus enters a cell, again, through the mucous membranes, your eyes, your nose, your mouths, once it enters there, it goes to the cells and it goes into the bloodstream, where then it goes through the entire bloodstream and the lymphatic system, and that's how it affects us as a whole body level. So that's how it affects us. So if you can imagine that once the immune system is done fighting it and has kept it at bay and it's not so bad anymore, that the symptoms are done, right? So again, now you got to imagine that it's still somewhat replicating in those cells, right? Maybe it might be not in the millions, but it might be in the thousands, right? So it's still somewhat replicating in those cells that you have all of your body, your mucous membranes. So even as I'm speaking here, I'm releasing some kind of fluid here. So you should definitely be safe that even if someone has recovered from the disease, we do hypothesize or believe or have some preliminary evidence that there is a chance that they can still possibly transmit the virus, possibly. But again, there's no concrete data yet, right? Because again, this is all new. It's only been a few months, and we have to see data saying that, hey, like this patient got it from this patient, and then we have a huge set, and then we can say yes, it's definitely possible that someone is still transmitting this. But in the meantime, just be safe and just again go back to the way I explained it and think of the actual mechanics and the science of how it works, right? If you think at the basic level that yeah, it is possible, so why not just be safe, right?
Mashallah. Dr. Saab, I think you've given us a lot to kind of absorb. And before we conclude, and before I ask you to kind of wrap up both scenarios, the biggest thing was we were planning this. The biggest feedback we got from years past is do it before Ramadan. So now we did it,
Yeah.
and we're in COVID-19. We're in COVID-19 because, mashallah, it's one to see is the way that you do your PowerPoint presentation and stuff like that, and you talk about your personal life as well, which I think people unfortunately don't get to see this year, even though we planned it right this time. But
Yeah.
inshallah, next Ramadan,
Inshallah.
we can do that, inshallah. So I'll go to the last question from a brother. How do you maintain a good, healthy balance in your weight for throughout iftar and stuff like that? Because some brothers, they'll have their suhoor, read fajr, and then go to sleep. So all of that kind of sits. And then iftar, whether they read tarawih or they don't read tarawih, they eat and then go to sleep so they can get that sleep in. So how would you say to help maintain that balance?
Yeah, absolutely. And that's definitely something that can be, of course, answering his question, but for every single person listening, everyone wants to, for the most part, maintain their weight, right? No one wants to be able to, balloon up during this time. And so we should bring it back to the fundamentals of how, our body uses food, right? So when we're out about in our day, we're working, we're out and about, we're burning lots of calories because we're walking, we're breathing, all our cellular processes are happening. So stuff is being used. So during that time, of course, it's a lot harder for fat to be stored unless you're eating, very, very type of inflammatory types of food that can be stored as fat. But now during this time when we're all kind of, quarantined for lack of a better word, and we are, for the most part, again, working from home or just making small trips, and our activity level has substantially decreased. So yeah, think about it like that. You know what? The food I was eating before, it's not really going to work out now because I'm not as active anymore. So just take it back to bring the portions down, planning your meals out, and again, giving yourself time, making sure that you're not just eating because this is how much you used to eat. Listen to your body, see how you feel with that certain amount of food, and after which you can modify it. You can eat more or do you need less? That's one thing I would tell them to do. After that, the second thing would be why not use it as an opportunity to actually increase that energy level, right? So of course we can't really go out for a huge, long walks because that's not social distancing. But if you were just maybe walk around your house, do housework, the non-exercise associated thermogenesis, NEAT is what we call it. So if you have a high level of NEAT, we've seen people who are relatively thin. It's not because they're amazing athletes for the most part. It's because they have a high NEAT level and they're always for the most part active. They're not really like sitting or sleeping. They're always doing something, and that burns a lot of calories throughout your day and throughout your week and throughout your month. So you can imagine that that adds up if they're always doing that. And so I would say stay relatively very active. Don't at least for me personally, I try to not sit as much as possible. I try to go out and do things and walk around. Any activity you have, any opportunity you have for an activity, go for it. Do it around the house, help around, and then that's number one. That's neat. After that, yes, exercise wise, we can actually incorporate exercise into Ramadan as well while we're at home. There's a great website or a business that I love to promote is called Amana Fitness. You can Google them, amanahfitness.com, and they're a fully Muslim business, and they're all about helping you with your fitness and with your eating, with your spirituality, and especially during Ramadan, they have tons of programs for you, tons of free ebooks. That can help you with your exercises, but I'll just summarize some of the stuff that they're talking about in terms of exercise. They recommended 6 different times. So they said either before suhoor, or right after suhoor, right before iftar, after iftar, or again in the middle of the night. They said those are possible times. So you can pick whatever time works for you and make sure you're well hydrated. All that stuff is there, of course, when you should be hydrated. But the exercises you can do are all at home. The best weight we have is our own body. So if you can just again go on that website and find some of their stuff, and it's for any age group, any physical fitness capability, anybody can do it. It's not you don't have to be out there running on your treadmill or on your track or weightlifting. Just stuff at home with the things you already have. Without any equipment, you can absolutely get a good like 5 to 10, 20 minute workout wherein you've challenged those muscles and now they need it. They need nutrition and they'll get that from the food you give them, and then they'll use that to build muscle, and that's how we maintain our physiques or maintain our weight. You don't want to get in the trap of, you know what, I'll just keep eating less and then hopefully I maintain my weight, because then your body will adapt, right? You want to keep challenging your body and make it do some things that it's not used to, which is what exercising is, within your capability, right? Getting better every single day. And then what the body does is it'll adapt, it takes some nutrients, and it'll increase your metabolic rate, which is how many calories you burn. And if you do that regularly, then that's how you stay relatively, fit, and you maintain your weight um, for a long period of time. So I would say for that, brother, absolutely make sure that you increase your NEAT, try to exercise during those times. It'll be laid out very nicely in that website if you check them out, amanafitness.com. And then of course, control or modify the amount of food that you eat, because be cognizant of how much you're putting in, how much you're actually putting out.
Well, it's a very good. So the brother that was asking it, amanafitness.com. As well, if you need more information, you can contact Dr. Saab. Google him. That's the best way. He's known,
Google me.
Dr. Muffaqam Shah. Mashallah. So, Dr. Saab, if we were to wrap up in the sense of your kind of final message, your pagham in regards to COVID-19 as well as healthy Ramadan, if you can sum up your discussion as your final message.
Sure. So I would say we are in a very unique situation for our generation. This is absolutely trying times, but it doesn't have to be, a punishment from above. It can absolutely be a great opportunity for us to better ourselves spiritually, mentally, physically, emotionally. It's absolutely an opportunity for us in all aspects. So first things first is a change of mindset, that use whatever you have around you to better yourself, right? And then the second thing is Ramadan. With Ramadan approaching, it's another opportunity again for you to just better yourself, right? So absolutely take it as an opportunity and not as a negative or a punishment. Use the best resources around you. We have the internet nowadays. It's amazing the stuff you can have coming straight to you, information, help, reaching out to people. You have so many things at your disposal, right, on your phone, on your tablet, on your laptop, that you can use right now to absolutely, better yourself. So think of it as an opportunity and use it to the best of your ability, and you will come out, stronger and better. And you're gonna look back at this and feel like, that was our best Ramadan ever, inshallah. And as far as summing up the COVID situation, I would say that we, the things that we've been doing have been working. This is why we're seeing, the stagnation and the number of numbers. It haven't had a huge increase, right? The graph is kind of plateaued for the most part. So we have to continue doing those. They're there for a reason. Again, if you want to go back and listen to the beginning of this talk, where we talked about how it actually spreads and the mechanics and the science of it, just so you can kind of get a visual representation of what's going on and why we need to do those things. It'll really help you understand, like, you know what, we have to continue doing them so that we can actually be on the downward trend, and then hopefully get back to some sense of normalcy in our lives. But again, use it as an opportunity, right? You are at home, you have so much more free time. All the stuff you said you wanted to do because you didn't have time to do, start doing it now, right? All the people you want to connect with them now. So again, use it as an opportunity. Make sure you take care of yourself, mentally and physically and spiritually, and don't let this chunk of time go to waste and be like, you know what, I'm just going to keep my life on pause, and then we'll see what happens once all this is done and I can get back to regular life. No, use it as opportunity to to fulfill and better your life.
Mashallah. Dr. Saab, beautifully done as always. I always enjoy it because I sometimes add in my personal questions and,
Yeah, no problem.
and stuff like that. So from our team to you and your family, we wish a happy Ramadan, a safe Ramadan, and we
To you
wish
as well.
that you guys stay safe on the health side as well as in the month of Ramadan. And I want to thank you because you are a frontline worker and what you do, and you put your life and your health at the risk for the betterment of others. From our families and our team here, we want to thank you for all of your efforts.
My pleasure. Thank you.
And inshallah, next Ramadan, before the month of Ramadan, we're going to do that
We'll do it again.
slideshow,
Yeah.
inshallah. But
Yeah.
thank you very much once again. And our
And I'd
du'as are
like to
with you.
say thank you so much to the Sufi Council Toronto, Mecca Islamic Center. You guys have been so kind every single year to invite me back. And right when I basically started, I graduated med school, you guys had me on here, and talking. And that's a great amount of trust you placed in me. And then we've basically grown together, right? Starting off, we had just a mic and a PowerPoint. That was it. And now we've got mashallah, we're online. We got people viewing. We got questions coming in, and inshallah, we'll keep growing like this in the future.
Absolutely, inshallah. All the best. And again, if you need any support from us, we are here for you and your family.
We will do. Thank you so much. Jazakallah.
Assalamu alaikum. So this was Dr. Muffaqam Shah Sahab, mashallah, incorporating obviously his update in regards to COVID-19 and informing us about that, and his take on how we're bending the curve and how we can continue to make this better for the future. And then as well as a healthy Ramadan. I mean, it's unfortunate that we can't do the PowerPoint presentation this year, but inshallah it's very good the way he breaks it down and completes it for everyone and answers questions according to the sunnah. Mashallah, Allah subhanahu wa ta'ala bless them and their family and give them more knowledge so we can kind of learn both aspects, the healthy aspect from the medical side as well as in part of the Islamic way and the sunnah of Rasulullah sallallahu ta'ala alayhi wasallam. So there you have it, dear viewers, both the male and the female side for the brothers and sisters. Inshallah, please share this before the month of Ramadan as we are almost a week away or less than a week away. So please share this video to your friends, family, loved ones, brothers and sisters so they can reap the benefits to make this a prosperous Ramadan, inshallah. So as we conclude, what I will say is there's going to be a short video after we are done here. Please stay tuned. It's about helping the Makkah Islamic Center. So I urge you guys in the month of Ramadan, please reach out and support the Institute so we can better ourselves and we can keep it running and do programs like this for the viewers and the community, inshallah, to build awareness on many different levels and aspects, and we can kind of evolve together and grow together, inshallah, in knowledge.